The chief medical doctor and health educator for the U.S. warns of the link between alcohol and cancer. The Surgeon General says alcohol is a leading cause of preventable cancer, surpassed only by tobacco and obesity. But, he says, the proven link between alcohol and cancer is not widely known. He proposes that the risk should be clearly labeled on drinks Americans consume. New warning labels would require approval by Congress and would likely face opposition from the alcohol beverage industry. And for more on this, let's bring in Dr. Chen Xi. He's Assistant Professor of Health Policy at the Yale School of Public Health. Doctor, thank you for joining us. And I'd like to know, in the last few years, we've seen medical opinions shift around alcohol. Why is this?
Glad to join you, Diego. So in the last couple of years, there are growing evidence coming out linking alcohol consumption and cancer. So this is well established. The risk is related to the amount and the frequency of alcohol use. And even moderate drinking can cause cancer risk. This is the Surgeon General's report. And there's nothing new from here, but what's new is how to make the public more available through labeling, through tax and other things, because we know it's so challenging. This is not about the economic concern only, but also like people have a tradition, culture ingrained with alcohol consumption.
I see. And Dr. Chen, is this topic now more urgent than, for example, the liver problems associated with alcohol?
Yes, there are several cancers clearly established to be associated with cancer, like mouth, throat, liver cancer, breast cancer, especially for females, and colorectal cancer.
Absolutely. And after this warning, what do you expect will happen, not only from the labeling point of view, but also from a scientific point of view? What's changing? Do you expect maybe the incidence of these cancers to go down?
Yeah, currently the Murphy's calling for the series of actions to increase public awareness, because even with the current labeling, there's a current policy regulating that females or pregnant women who are drinking during pregnancy will have harm, and also drinking while driving or operating machineries can cause harm. Those are already established and being implemented, but introducing more labeling would be alarming. Label would cause more challenge to the legislatures, because it would be against the industry lobbying. We know that alcohol companies and trade groups spend millions of dollars each year on labeling to push for regulations that favor the industry. So it's very difficult to be against that. And there are some states with state policies to tax alcohol use, and at the federal level there's a tax, but the tax never changed after the 1990s. So eventually now we see that the tax in terms of the share of the alcohol economy is reducing. So that means that we need to charge higher tax. But this is very much against the will of the public. So those are things that in the agenda, but has been very challenging to get through.
I see. We're just off the holiday season. Warnings like these, for example, have changed your alcohol consumption patterns?
Yeah, indeed. I'm always alcohol-free without drinking, and I would encourage people, especially starting from young adults, to be cutting back from their drinking. Not mention about the abstaining from more drinking, but I think that's very good for health. And every year there are 20,000 people dying from alcohol use only. There are even more from tobacco use. And we know that alcohol use and tobacco use are complementary goods. So once you are cutting back one thing, it will be also beneficial to other things. And overall, addressing the issues about alcohol use is not only for the sake of preventing cancer. I would say that there are tons of very challenging chronic conditions associated with alcohol use. For example, hypertension, diabetes, and dementia. So once we are able to cutting back on alcohol use, it will also be helping us to address some other very costly chronic conditions.
Great.
So it's like
Dr. Xi,
yeah,
thank
like
you very much. Great having you.
Thank you.
Thank you.